Good afternoon, everyone. Today's session is going to be really helpful and is led by Dr. Ramni. He is going to talk about common skin conditions in newborn babies. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Right. Thank you very much. So, I'm Dr. Ramni Ranjan, Senior Consultant, Neonatology and Pediatrics at Apollo Cradle and Children's Hospital in Greater Noida. So, I welcome you all for today's session. Today, we will discuss a bit about common neonatal skin conditions. So, newborn babies may it's very common to have skin issues, and most of them are benign. That means most of them they do not need any treatment and are self-resolving. समय के साथ अपने आप ठीक हो जाते हैं. So कुछ conditions हैं जिनके बारे में we should know because there is a very common parental query about the skin conditions. So the first thing that we see immediately after birth is ectrocyanosis यानी बच्चे के जो सोल्स होते हैं और जो तलवे और palms होते हैं वो थोड़े नीले दिखते हैं है ना. It is because of the vasospasm. Yeah, you can say it is kind of an adaptation response, and usually is because of cold weather and cold room. So once we take care of the temperature of the room, usually it improves. Yani immediately after birth, you may see the soles and palm of the baby blue, and it could be normal. But of course, if the bluishness is persisting, or if it is like involving lips and other part, then it is not normal. And then of course the doctor will look into it. What were the possible causes? Then there is something called erythema toxicum, a small whitish spot surrounded by a red base. This is again very common. First few days में ये हमें दिखता है, and usually by first week of life disappear भी कर जाता है. It's very common, very benign. It may appear you know quite widespread as well, may involve part of the trunk as well, but usually does not involve palms and soles. So this is again very common skin condition, and usually it will get better in a week or so. Usually doesn't persist beyond that. Some babies may have it little longer, but most instances it doesn't persist beyond first week of life. Then there is something called transient neonatal pustulosis. इसमें छोटे छोटे दाने होते हैं, फ्लूइड फिल्ड दाने होते हैं, जो कि जन्म के समय से ही right from the time of birth they are visible. Again, it's a benign condition. It's a harmless condition जिसमें बच्चे को कोई पेन या किसी इन्फेक्शन का रस नहीं रहता है. And most of the times 2 से 3 दिन में ये अपने आप ये दाने जो हैं ये they get better. The fluid might come out, and some scarring might be left behind, which is called hyperpigmentation, and it might take a little bit for it to go away. But most instances, again, this is a very benign condition. But again, having said that, if you see there are a lot of pustules, या fluid filled pus, the छोटे छोटे दाने अगर पूरी body में है, then of course it's very important to get the baby checked by doctor, because in rare instances it can be infection as well. But usually if it is present right from the birth, it is transient pustular melanosis of newborn. And then there is something called milia. जैसे कि हमें heat rash होता है, वैसे बच्चों में भी milia condition है, छोटे छोटे दाने all over the body, especially back, nape of the neck में मिल सकते हैं. Again, it is a very benign condition and it should get better with time. Parents को normally we suggest not to apply a lot of product over the skin in first few days, because skin is very sensitive, especially mustard oil we should be avoiding. Usually we do not recommend heavy moisturizer, right, or a lot of products right from the very first day. Usually after a few days, once the cord has fallen off, after bathing has started, uske baad usually we can start oiling and massaging. But usually first few days it's better to avoid it, because the skin is very sensitive. There is going to be some adaptation changes in the skin, and then it will be very difficult if you start applying. It will be very difficult to make out whether it's because of the oil itself or it is just a neonatal benign condition. Then there is something called Epstein pearls, यानी छोटे छोटे मोती के जैसे दाने ऊपर inside mouth buccal areas में देखने में आते हैं. This is again very common. Usually first month or so it will disappear again. These are very common conditions that we see in newborn babies. Apart from that, there could be some birthmarks also, like salmon patch कहते हैं हम लोग. It's red macules in the back of the neck. It's very common in Indian babies also, and Usually when the babies, they have less hair, it is quite evident, and the parents will come and ask, ye to pehle nahi tha, but usually it's present from the birth. Sometime it become more prominent in next few, weeks and months, but usually with time it usually goes away. Then there could be port wine stain, jahan par ki, one part of the face, there could be a very significant stain or mark which is present right from the time of birth also. So usually if it is very significant, the doctor might like to conduct some more tests to see if there is any association with any other disease or not. Then something called capillary hemangioma, जिसे हम blood vessels का गुच्छा कहते हैं हिंदी में. So you may see there part of the area is very very red, elevated है surface से. So again, it's a very common condition, and usually first few weeks and months it might increase, and then slowly it starts disappearing. By 2 years of age, काफी हद तक ये हेमेंजियोमास अपने आप ही ठीक हो जाते हैं. If it is involving some vital area, suppose कर ले बिल्कुल आंखों के ऊपर या बिल्कुल नोज के पास या अंदर में कहीं बहुत vital areas में है, बिल्कुल genital area में सुसु या पोटी वाले रास्ते में, then it might need treatment also, because there is a chance of ulceration or blocking the vital areas or organs. So based on the location, size, whether any ulceration is there or not, we have to decide whether we want to treat it or leave it. And as I said, in most instances, in due course वो अपने आप ही ठीक हो जाएगा, but in some children it might actually increase and lead to ulceration wherein the treatment may be required. So it's good to let your doctor know if you see any new rash or which is something which was not there or it is becoming prominent. It's always good to discuss with your doctor. There's something called neonatal acne. चेहरे पे ना जैसे जैसे एक्नी होती है एडोलसेंट्स में, वैसे बच्चों में भी, न्यूबॉर्न बेबीज में भी देखने में भी आता है ये. This is again because of the hormonal withdrawal. It's a very common and benign condition. Usually you just have to wait and see, and 2 week 3 week में automatically धीरे धीरे ये acne चला जाता है. In some children it may be little longer, like persisting up to 2 months or 3 months. But again, we avoid applying too many products over face or any cosmetic products in children. We have to keep it very simple. Just a good moisturizer which suits the baby. There is no fixed formula. Some children might be liking one product, some other might be liking other product. So whichever product is suiting your baby, I think we should continue that, and do not overdo it. That's also very very important. There's something called seborrheic dermatitis, जिसमें कि आप बच्चे के जो स्कैल्प है उस पर आपको फ्लेकीनेस दिखेगी, white flakes दिखेंगे. Sometimes it starts involving face, back of the ear, so it's a rough area of the skin, and it appears little brownish चीजें उसके साथ चिपकी हुई हैं. So again, it's a very common condition. If it is widespread and it is leading to discomfort, sometimes we want to treat it with moisturizer, sometimes antifungals also, based on the symptoms, based on the extent of the disease. And most cases में ये भी 6 महीने में अपने आप ही डिसअपियर हो जाता है ना. So these are certain conditions that may present in the neonatal age group or little later, and as I said, most of them are benign. If you see a new skin lesions, it's always good to discuss with your doctor. If you see a change in skin lesion, you should always discuss with the doctor. And then, as I said, based on the symptoms, based on and based on what kind of lesion it is, it might need treatment as well. Um, and few general tips, like we said, suggest to parents, like is usually we avoid boiling with mustard oil, but it is quite irritant, and some children can have bad rash. Whichever oil suits usually is okay for the baby. Massaging is one practice that we promote, especially in winters, but we have to make sure that the baby remains warm during the process. Baby को expose करके बिल्कुल ठंडे रूम में ठंडे तेल से करने से there is a risk of hypothermia, या फिर बेबी का temperature कम होने का risk रहता है. So you have to make sure that the baby's and the room and your hand temperature is normal or yes slightly warm, so that the baby is not exposed to cold atmosphere. So this is very very important. And then always keep in touch with your doctor. Very rarely, if skin lesion is very significant, like nevus and large skin lesions which are involving very big areas of the body, then sometime dermatologist might also be required to look into it. Sometimes we ask our dermatologist friends if it is a very extensive lesion or it is something which is very uncommon. And sometimes a dermatological consultation might also be required. However, having said that, most neonatal infantile lesions in the early part of life. First month, second month is most of them are very benign and self-resolving, and usually it get better with time. So this is it from my side. If there is any question, then please let me know, and we'll try to discuss it. I can't see any questions or any queries. So if there are no questions and no queries, I think we can wind up the session here. So thank you very much. If there is any question or queries, you can always come down to Apollo Cradle and Children's Hospital, Greater Noida in OPD, and we can discuss about it. Not only skin related issues, any other issues related to newborn or children, you are most welcome to come down and have a word with us. Thank you and have a great day.